Hello, this is Jeffrey Berns from the University of Pennsylvania School of Medicine in Philadelphia, where I'm Professor of Medicine and Pediatrics in the Renal Electrolyte and Hypertension Division. I'm also Editor-in-Chief of Medscape Nephrology. I'm a little bit tired this morning, having stayed up late last night to watch the Philadelphia Phillies take the National League pennant, and now we're on to the World Series. My video blog for today regards the KDOQI process. The National Kidney Foundation is revisiting the KDOQI process a bit and relaunching it as KDOQI 2008 and beyond. The new mission of KDOQI is several-fold at this point. One of the parts that I'm going to be involved in as a vice chair of a committee working with Mike Rocco, who's the overall KDOQI chair, is to do two things. First is to provide commentary on KDIGO guidelines that are going to be coming out. One has already been written related to hepatitis C guidelines that KDIGO has done, and upcoming guidelines from KDIGO will be related to acute kidney injury and bone and mineral metabolism. So KDOQI will be providing some commentary on those to translate, if you will, those international guidelines for the U.S. audience. Over the years, as you know, KDOQI has completed 12 clinical practice guidelines and clinical practice recommendations. And the question I'd like to pose for the Medscape audience today is if you could please comment back to me which guideline areas that KDOQI has already written on do you think ought to be revised most urgently for your practice. So some of the existing guidelines are those related to hypertension, cardiovascular disease, dyslipidemia, anemia, chronic kidney disease, nutrition, peritoneal dialysis, hemodialysis, and dialysis access. So which of these do you think ought to be tackled first by KDOQI to update and revise and provide new commentary? And then the other question I'd like to ask of you is if you could please again submit through the Medscape blog any new areas of clinical nephrology that you think are worthy of some expert panels' opinions and assessment of the evidence for patient care. Some areas that I might suggest are myeloma kidney, lupus nephritis, the role of plasmapheresis in clinical nephrology, dialyzer reuse, water quality and the use of ultra-pure water for dialysis, when dialysis should be initiated, are perhaps some suggestions that you might consider. So think about this. If you could please submit a response through the Medscape video blog. I'd be very interested in hearing your thoughts and comments, as would Mike Rocco and others at the National Kidney Foundation. Thank you very much.